My name is Dr. Hillel Mazansky, and I'm coming to you today from San Diego, California. I specialize in medical hypnotherapy, guided imagery, nutrition, and exercise. Today's health tip is about pain, the truths about pain. If we start talking about pain, this can turn out to a couple of hours lecture, but I'll try and be as brief and concise as possible. For discussion purposes, we're going to divide pain into two main groups: acute, short-acting pain, and then chronic, ongoing pain. There is no one in the universe who doesn't suffer pain at one or other stage of their lives. Some of the pain is self-limiting and not serious, while the converse is also true. The acute pain is a pain that will last up to 3 months, that results from a sports injury, a surgical procedure, a sprain or a strain, a fall, and that type of injury is usually treated conservatively with ice, rest, and elevation, and maybe sometimes some anti-inflammatory medication or analgesics such as acetaminophen or Tylenol. More of concern is the chronic type of pain, and there are over 100 varieties of different types of chronic pain. In the United States, the most common cause for chronic pain is back pain, and $50 billion with a B dollars are spent annually on its treatment. The issue is that people suffer chronic back pain from minor injury, and then the pain gets worse, and unfortunately MRIs and CAT scans are done, and sometimes a herniated disc is shown, or it is proved that they have stenosis of the spine and they undergo surgery. And more often than not, that surgery does not help, leading to second, third, and even fourth surgeries. Those people become chronic pain cripples. Neck pain is very common as well. And then you have other forms of pain, such as irritable bowel syndrome with chronic recurrent abdominal pain, fibromyalgia, diffuse pains in the muscles that come mainly in females. And then you have a condition of phantom pain where some amputees have lost their legs or their arms, but after the surgery, after the amputation, they are still able to feel the pain. The exact mechanism is not known, but it is a true fact. Redhead females suffer more pain than her brunettes or blonde counterparts. The reason is not quite clear, but it is thought to be of a genetic predisposition. Females especially can develop pain in their hair if they make a ponytail too tight, or they tighten their hair in a manner that pulls on the hair and scalp. That can cause pain. Growing pains in children are true. Research has shown that the pains that they have in their legs are true pain and non-psychological. That brings me to discuss psychological pain. There are people who experience pain, and yet there is no organic cause for it. Usually in those cases, they are suffering either from anxiety, stress, depression, but to them, the pain is real. And it behooves the physicians to take a proper history and an examination to rule out any organic cause. In the seniors in America, the vast majority of pain is arthritic pain, and in the younger people is migraine pain. And there are over 100 medical conditions that are associated with arthritic pain. Osteoporosis can cause pain and can lead to fractures. And this has a negative effect because there are complications. Patients fracture their hip and they have sometimes ongoing pain after the surgery. The chronic pain patients are treated with far stronger medication than the mild analgesics. They are treated with morphine and different opioid medications. The issue with these medications is that after a while they lose the effect and the pain is not controlled. They then go to the doctor who gives them a higher dosage of medication, and it leads to side effects. Today, pain treatment has become a speciality, that there are physicians, usually anesthesiologists, who have subspecialized in pain control. And there are all sorts of methods that are used, from injections into the spine, such as an epidural, the same type that a female has during her childbirth, or they can do what is called a radio frequency ablation, where radio waves are inserted into the small nerves of the neck or the back, and that kills off the nerves and the pain improves. But again, the issue with that is that the pain can return in time as those nerves grow back. Tooth pain can sometimes be not a sign that there's something wrong with the tooth, but it can be a sign that there is something wrong with your sinusitis. Besides the regular treatments that are out there, people, you have no idea how hypnosis can empower chronic pain sufferers to treat themselves. This is non-toxic, there are no side effects, and they can just listen to a video that we make for hypnosis. They listen to the video twice a day, and that empowers them and improves their pain. A nutritious diet is also given. Exercise with pain is important. Initially, when the pain is so severe and acute, you cannot exercise. But when it becomes chronic, exercise is very important in the treatment of pain, because the patients start feeling better and easier the more they exercise. Exercise begins in a very light manner and then goes to moderate, and when they're feeling better, which they will, they proceed to a stronger form of exercise. These are the main types of exercise and their treatment, and please try and stay away from morphine and the narcotic agents, because they have terrible side effects and they don't work for some time, and then you need to increase the dosage. I hope this video has helped you, and I wish you good luck, and take care of the pain as soon as you can before it becomes chronic. My name is Dr. Hillel Mazansky, and I thank you for listening to the video.